Alright, so we'll try to look at some bone changes that you could actually see on imaging. So this one, they show whether the bone activity at the place is too much or the bone activity at the place is too low. Do you understand? So if it is low, you say that hypometabolic. If it is high, you say that it was hypermetabolic. So let's look at how their characteristics will actually look like on imaging. So for these ones, what we got is this. So on imaging, particularly when you're talking about the PET scans, bone regions can appear what? Hypometabolic or hypermetabolic, and this is depending on the issue. Okay, so of course those terms depends on the underlying pathology, right? So that's just what we got, coming. So hypermetabolic, these are areas with increased tracer uptake, meaning there's higher bone activities going there. So if I see, all these places, so much red, do you understand? Focus on the bones. Let me say here, do you understand? Down to the lumbar spine is darker, shows you that there's more activities there, right? It could be because of cancers, it could be because of primary bone tumors, it could be because of infections, it could be because of what? Inflammation, it could be because of fracture healing, it could be because of arthritis. All right, then so the imaging will show bright hot spots on PET scans. So hypometabolic is just the direct opposite of the other one, just the direct opposite of the other one. So they're just areas with what? Decreased tracer uptake, meaning there's reduced metabolic activity. Maybe bone infarction, avascular necrosis, reduced blood supply, radiation-induced bone changes, then radiation-induced bone changes, chronic infection or necrosis, some certain cancers. All right, so on imaging they call that the cold spots. All right, so any other place here is a cold spot. Okay, no, this image I like it more. So any other place here is a cold spot except this, this and this. They look darker. It shows you that there's like increased activity there.